Hello radiographers, hope you are doing good. So let's start CT urogram. For this, patient position is head first supine and select from the abdomen CT IVU. It is saved as CT IVU in my software, and select head first supine and then press OK. So at first the topogram will load. So right now the patient is positioning. For CT urogram, center the laser light over the diaphragm or mid chest, so that from the dome of the diaphragm to the symphysis pubis a scout topogram is scanned. As the position is completed, click the load button and the topogram will load and wait for some times. And now press start button on the control box. And a topogram of abdomen will appear. And now plan the non-contrast scan. For this, adjust the field of view of the scan area. So I will take a non-contrast scan from the dome of the diaphragm to the symphysis pubis area, and the non-contrast is scanning. And you can see that there is two reconstruction is happening automatically. And now it's time for arterial phase and venous phase. So in this meantime, I will prepare for contrast. For CT urogram, take 70 to 80 ml contrast, or you can select contrast dose as the patient weight per kg body weight. So in this case, the patient was 68 kg and I took 70 ml contrast for this. And now I am preparing to inject contrast with the auto injector. Press the move button before injecting contrast. So that the table move at the correct position to scan the post contrast scans like arterial phase, venous phase, and then urogram phase. There are 4 phases of CT urogram. One is non-contrast phase, and then nephrogenic phase, and then corticomedullary phase, and then excretory phase. So these 4 phases should have been taken for CT urogram. Arterial phase is normally taken just after the contrast is injected, or 20 to 25 seconds post contrast. And this arterial phase gives you a nephrogenic phase of the kidneys. And then after 1 or 2 minutes, it will give you a corticomedullary phase. And then after 10 or 15 minutes, scan will give you urogram or excretory films. From the excretory films, you can make urography films. The urogram scan should be taken for multiple times because you have to visualize the ureters in all the way with the contrast from kidneys to bladder. So sometimes after 5 or 10 minutes it may not visible. You can take it multiple times and find the correct scan to make a 3D CT urogram image. You can see how I can do it. I'm waiting for auto injector is prepared or ready for contrast. I'm waiting for auto injector is ready to push the contrast. The contrast should be injected followed by normal saline to get the highest density of the contrast and use the maximum contrast that you take from the syringe, that you take from the bottle. The proper timing is important in case of CT urogram because you have to visualize the nephrogenic phase, then corticomedullary phase, and then excretory phase. Injector is ready. Press the move button from the control box and then table will go to in center position and then press start button and injector button at the same time. So right now arterial phase is scanning. You can see there is contrast in the abdominal aorta and the arteries, and now venous phase will scan automatically. So it will be a corticomedullary phase in this scan. So right now my initial 2 post-contrast scan has been completed. And I will take urogram a few minutes later. So I am checking the arterial phase. You can see that the kidney is visualized very good, and also checking the venous phase. I type here pyelogram because after 5 minutes renal pelvis is visible and it's called the pyelogram. So I will take another scan after 5 minutes, and this is the urogram scan, and you will see that the contrast is excreted from the renal pelvis. And there is some abnormalities in the of the patient, so we will see it later what is the abnormality. Right now I am just scanning. You can see the left ureter, but there is no right ureter visible. Only there is some contrast in the renal pelvis, but it didn't flow inside in the down. It didn't flow down to the ureter. So maybe there is some problem in the right ureter, or there may be hydrocephalus. So let's see next. So you have to take urogram scan 5 minutes later. It's one type of IBU, but with the CT scan machine. So you have to take post contrast images in scans in 5 minutes, 10 minutes, 15 minutes, and even half an hour or full bladder. So then you will get a proper image in one scan to show the whole ureter with the urinary bladder. Now after 10 minutes I will repeat the urogram scan. So let's see how the contrast appears in the 10 minutes scan, and comment out as 10-minute delay and load the scan. Press the move button so that the table moves to the center, and then click start. Press start button, and the delay scan will happen. So in this scan you can see that the contrast is more dense in this area and some contrast in the urinary bladder. And I will repeat this. After 15 minutes I am taking this scan after 15 minutes and press the move button again so that the table moves and at the center point, and now the 15-minute scan is happening. And in this scan I can visualize the both ureter, but right ureter is not visualized in the whole length, and also the bladder get the contrast. So there is a mass lesion in the patient's lower pelvis. So doctors want to see there is an involvement of the lesion with the ureter. So in this 15-minute scan you can see that the contrast is running down on with the both ureter to the urinary bladder. So let's see how I can visualize the ureter in 3D. I'm checking all the excretory phase scans in 5 minutes, 10 minutes and 15 minutes. And now I will repeat again the urograms scan after, I think it's 30 minutes. Sorry, after 20 minutes I will repeat this scan to see how the contrast is visible in the ureter. So press the move button and press start, and then a 20-minute scan will happen. In 20-minute scan, you can see that the ureters are showing on both sides, and also the urinary bladder getting the contrast, and the bladder is filling with the contrast. And you can also see cystic masses in the lower abdomen of the patient. Now, this is a female patient, so there is some abnormalities with the ovaries or uterus. So now let's check in the 3D how the ureters shows. Take the 20-minute scan to the 3D, and from the BRT gallery I'm selecting BRT gallery. I'll select vascular. So this 3D process is best to perform in the Singo Via, but right now I am showing on the Singo CT. Singo Via will automatically remove the bones and show you only the ureter and renal pelvis and the bladder. So in this software Singo CT, you have to remove the bones manually by cutting them. So I am checking all the option from the BRT gallery, and in this view you can see that the ureter, renal pelvis, and also the bladder is visible. The right renal pelvis is dilated. Maybe there is some compression over the right ureter in the lower pelvis. I am taking the ureterogram scan again at the 30 minutes. So repeat this scan and press the move button to move the table to the center, and press the start button, and the 30 minutes ureterogram scan will be happen. In 30 minutes scan you can see again the ureters is visible, and the right renal pelvis is dilated, and the contrast is going down with the ureters, and also the bladder is filling with the contrast. I think this is the best scan in 30 minutes that I am able to visualize the ureter in all the way. So let's check it out in the 3D app. So select the 30 minutes scan, that is 1 millimeter reconstructed, and take it to the 3D, and now select the BRT gallery. I'm checking the in 2D image how the ureter is visible. In the coronal image I am just dragging the reference lines over the sagittal image, and now I will make MIP images in 60 millimeter, and I'm checking the ureter. And I will select the MIP directly, and also you can select MPR in 50 millimeter. I'm just experiencing all the option in the 3D. Now I have to select 100 millimeter in MIP. So now from the BRT gallery I will select the vascular, and you can see that there is bony skeletal of the abdomen and the pelvis area, and also you can see the renal pelvis, the both ureter and the bladder. So I am able to visualize the right ureter almost all the way, but lower ureter is not visible, but left ureter is visible in all the way, but right ureter is not visualized at the lower end. So maybe there is some problem with the lower ureter. So I will take the urogram again. I will repeat the urogram scan again to see how the lower ureter looks. Can I able to show the lower ureter in this scan? So I think this is a 35 or 40 minutes scan. The scan is completed. Let's check it out. So let's check it again in the 3D. This is a 20-minute scan that I am checking. I am tracking the right ureter, that how far it goes, how far it visualizes. So there is the transition point where the ureter is not visualized, or it's mixed with the cystic lesion, or it may be compressed by the lesion. So let's check it in the 3D. So I am checking the last scan that I take at last, and from the VFT gallery I am selecting again the vascular option. So I think this is the best for urogram in single CT, but in single BR there will be more option. So I am rotating the image to see which angle is best visualize. Now it's time for printing, I think, making the films. So I will take the first the non-contrast 1 millimeter slice thickness sequence to the 3D, and from here I will make the axial images. So I will plan on the coronal image. I will plan over the coronal image and drag the first slice to the mid liver, and I will select the number of images to, I think, 55 or 47. I select 47, and I will drag the last slice to the symphysis pubis, so that from the kidney to bladder area is covered. So I am making 47 axial images, non-contrast images, and save and send it to the filming. So right now I am in filming and select the layout 4:7. I will select 4:6 so that 24 images fit in the film, and adjust the image Adjust the zoom pen and contrast, and at the last film you can see there is one segment is empty. So for this I have to select the topogram and drag it to the first segment and adjust its contrast. So this is two non-contrast axial film that I am printing. Now I have to select the arterial face 1 millimeter slide thickness and take it to the 3D app. And again, just like the non-contrast film, I will make axial images planning over the coronal image, and I will select the slide thickness 5 and number of images to 48 and drag the first slice over the kidney and covering also the adrenal gland, and drag the last slice to the symphysis pubis so that the whole of the bladder is covered, and click start, and my arterial face images have been created, and I will save and send it to the filming. And in the filming I will adjust the film images and slightly zoom in to fit the segments, and also the second film of the arterial face I will adjust it. In the arterial face, contrast is just entered into the kidneys and only the cortex is visible in this phase. The renal cortex just receiving the contrast in this space. And now I will make another series from the venous phase, and again I will make 48 axial images from the venous phase and drag the upper slice to the over the kidneys including the adrenal gland, and also the lower slice to the symphysis pubis area. So from the adrenal gland and to the symphysis pubis area is covered. So right now I have taken the 5 minutes film to the 3D app. So this is the post contrast 5-minute excretory phase scan, and I am checking the kidneys and ureters how it's visible in this phase. As I am not satisfied, I will take the another one or late phase. So I think this is the 15 minute scan, post contrast scan. And in this phase the bladder is get a small amount of contrast. Now I have selected the 25 minutes scan. In this scan the bladder is visualized very good, and also the ureters. I am checking all the scans, post contrast scan or all the excretory phase scan. I was wrong. The scan I showed before was actually 20 minutes, and this is the 30 minutes scan that I am making 48 images of this excretory phase. So this is a 20-minute scan. This is a 20-minute scan of the excretory phase or urogram. From this scan I am making the axial images and take the 48 slices to the filming. And in the filming the layout is 4:6, and I will adjust the zoom of the image and panning the image so that it fit in the segments. So bladder is showing beside the lesion in this phase. So this is a 20-minute phase. And I will make a coronal image from this series. For this I have to plan on the axial image and select the thickness 5 and adjust the slices. I have select the thickness to 10 slice thickness so that the ureters is show better, and I will change the number of series. I will increase the number of images, and again I am changing the slice thickness to 30 millimeter series showing the ureter in the coronal 2D image. And I will change the number of images to 25, and also the image thickness is 5. I'm dragging the slice to check to cover the ureter and also the bladder in the images, and click start, and the coronal images have been created. So now click save and send it to the film and go to filming, and for coronal film change the layout to 5:5. So this is the 20-minute films from the urogram. Now I will make MPR thick images by changing the slice thickness to 30, and in the MIP segment you can see that the ureters is visible, and you can rotate this. So there is 9 2D films that I made for Eurogram, and I have post-processed the Eurogram film on the Singo via that I will share later. The post-processing of Eurogram film in the Singo via. So always use Singo via for 3D post-processing of the Eurogram. So thanks for watching. If you like this video, please hit the like button and don't forget to subscribe my channel and share your opinion in the comment box. And thank you again.